Control of infectious disease is ultimately a question of first breaking the chain of transmission and then preventing new chains to establish. In humans, these objectives are commonly achieved through pharmaceutical interventions, vaccination to reduce susceptibility, and drugs to cure disease and shorten infectious periods. Convalescence and quarantining are two additional non-pharmaceutical interventions to reduce contact rates and slow transmission. The farm industry has another non-pharmaceutical intervention tool, culling, killing of infected and sometimes even susceptible herds to stop circulation. Foot and mouth disease, FMD, is a highly contagious disease of a range of domestic animals such as cattle, sheep and pigs. It causes weight loss, reduced milk production and often high mortality in young animals. Because it is of great agricultural concern, disease-endemic countries have a restricted export market compared to disease-free countries. The disease is caused by a virus against which commercial vaccines are available. However, vaccines are quite strain-specific and there are numerous serotypes. Routine serological tests do not distinguish between vaccine-induced immunity and infection-induced immunity. Early vaccines were available by the mid-1950s. Before then, in the early part of the 20th century, broad-scale culling was the only option, sometimes involving the killing of more than 100,000 farm animals, as was the case in the 1914 and 1924 outbreaks in the US. Horrific numbers at a great economic cost given the size of farms at this time. One would think that the availability of the vaccine would make the choice of intervention an obvious one. However, here is where economy enters the equation. The World Organization for Animal Health classifies countries in three categories: FMD present, FMD absent with vaccination, and FMD absent without vaccination. The latter distinction is because of the difficulty in distinguishing past vaccination from past infection. The worry is that what is thought of as a vaccinated animal for export is instead a disease carrier. Countries classified in the first category has the most restricted export market, and countries in the last category have the greatest export market. The 2001 FMD outbreak in the UK highlights the complexities of decision-making regarding intervention in the farm industry. After sequential refinements of the vaccine and large-scale application, FMD was effectively controlled and practically eliminated throughout Europe. In 1991, vaccination was halted. The countries of the European Union became FMD absent without vaccination. 20 years after, in early February 2001, FMD was reintroduced to the United Kingdom into a pig farm in northeast England, probably through illegal meat imports, according to the best reconstructions by the epidemiologists. By mid-March, cases were reported at several farms across the country due to regular movement within the livestock industry. Countrywide restriction of animal and people movement were quickly put in place. Through culling all cows, pigs and sheep of any infected farm and all animals on all neighbouring farms, the epidemic was slowed by the mid-April and halted by the end of July. Almost 2,000 directly affected farms had to have all their animals culled. To stamp out the epidemic, several thousand additional farms were also culled to leave no animals anywhere near the zone of contagion. At the end of the epidemic, UK remained categorised as FMD absent without vaccination, but it came at the price of culling 3.5 million cows, pigs, goats and sheep, and at a many billion-dollar cost. Culling is an important intervention for many other infections in the farm industry. It is the immediate first-line defence for any and all that spill over to cause severe human disease. For example, for acute avian influenza, we immediately make sure there be no more chicken carriers around. Similarly, when Creutzfeldt-Jakob prion disease was discovered, the first line of defence was to make sure there would be no more prion-carrying cows around. Culling is an important but more complicated issue at the interface between domestic and wild animals. There are currently two major debates in the US and the UK regarding culling of wildlife to prevent disease in domestic animals. Brucellosis, an important bacterial disease of cattle, have been eliminated from US cattle farms, but still circulates in elk and bison in the Greater Yellowstone area. Culling elk and bison in a national park to prevent disease from spilling over to surrounding rangeland is obviously quite a complex issue. Similarly, bovine TB is a farm concern in the UK, but the wildlife reservoir is the European badger, which is a protected species in the country. So culling here represents a major conflict of interest between agricultural and conservation concerns.